Michelle Obama's father, the famous comedian of the 70s Richard Pryor, Jack Osbourne, and Selma Blair of Legally Blonde and Hellboy fame. Now, what do these celebrities have in common? Well, guys, these are some of the names, some of the millions of people who were inflicted with a debilitating, painful illness known as multiple sclerosis. Yes, you guessed it right. Today, being the World Multiple Sclerosis Day, 30th of May 2020, I am Dr. Naeem Sadiq, coming to you with a very interesting presentation on multiple sclerosis. Now, in this video, I'm going to cover what is multiple sclerosis, why does it happen, what is the pathology behind, what is the mechanism behind, and when it happens, how will you recognize, what are the symptoms, various treatment modalities, and what does Plexus have to offer. The theme for this year by the World MS Federation has been connections. Connections, establishing connections between the patient and the community, the patient and the family, patient and quality care. Well, that's exactly what I have been striving all these decades for the last 32 years to give quality care, and especially for patients suffering from multiple sclerosis. Now, what is multiple sclerosis? Now, if you guys have seen my previous videos, in one of the videos I was talking about autoimmune disorder. Autoimmune disorder is a disease wherein the body's immune system goes crazy and starts attacking its own cells. Well, when it affects the central nervous system, the brain and the spinal cord, the neurons get affected, and the disease which manifests is known as multiple sclerosis. It is classified under demyelinating disorder of the central nervous system. When you look at any organ, when you look at anything, like for instance a building, when you look, now the building is composed of the basic unit in any building is a brick. The building stones, the building blocks, these make up the walls and the house and the room or the building or whatever. Similarly, each organ in our body has the basic functional unit. And in central nervous system, the functional unit is known as a neuron. Here, I have a diagram here to show you as to how does a neuron look. It is magnified several times to make things easier for you to understand. Now, this is the body of the cell, that is the neuron, and this is the tail of the neuron. Now here in the center, this is a long filament going, which is known as the axon, which is the tail. This is covered by the red thing here. This is known as myelin sheath. This is a protective covering which covers the axon. I can give you an example to make you understand it better. If you take a wire, you see the copper filament inside which conducts the electricity, and this is protected by the rubber casing. So the rubber casing is similar. The rubber casing here is the myelin sheath and the copper filament is the axon. Now, if this sheath is intact, now this neuron connects with another neuron and another neuron. They form synapses. Then the conduction happens. Whatever signal the brain gives, it is transmitted to different parts of the body. Now, suppose the sheath is disrupted. For instance, here it is disrupted here, it is disrupted here, it is disrupted here in several parts. Then the conduction does not happen the way it has to happen. Like for instance, what we get in a wire short circuit. The example may not be exactly 100% clear, but I'm just using this to make you understand. If the myelin sheath is disrupted in several parts, then the conduction which should happen very smoothly in this manner does not happen. It ceases to happen and the symptoms manifest. What are the symptoms? Now again, I would like to remind you of one of my previous presentations wherein I was talking to you when I spoke about the stroke, as to how the brain controls every single thing in our body, be it cognition, that is our thinking, be it emotions, be it our movement, motor things, be it our coordination and balance, or be it our sensations, or even the sphincters that control of urine and our bowels. Every single thing is controlled by the central nervous system. Depending on which area in the brain gets affected, the symptoms in that area manifest. Like for instance, if the neurons which are involved in vision, the optic nerve is affected, then the patient will have problem in his sight, in his vision. Patient will not be able to see properly. Suppose the patient's speech area is affected, the patient will have difficulty producing speech or difficulty in talking. If the patient's frontal lobe is affected, which involves the behavior, the patient might behave erratically. If the patient's motor area, the neurons affecting the motor areas undergo demyelination. So when this myelin sheath gets disrupted in several parts, it is known as demyelination. Myelin has been removed from there, or myelin is no longer there in those areas. So if the motor area is affected, the patient may either have weakness in the arm or weakness in the leg. Now, if several neurons in several parts, some neurons in the visual area, some neurons in the motor area, some neurons in the sensory area, then the patient will have a myriad of symptoms which may look bizarre at some point of time. Like, patient may have seizures, patient may have weakness in one leg, patient may have sensory problem in the other hand, whatever. Plus, patient may have emotional problems, depression, depending on the areas which are affected. So these are the symptoms with which patients with multiple sclerosis manifest. Whom does it affect? MS is, we don't have the exact incidence in India, but it is a very, very common disease. By and large, the women are affected more than men, and it generally is seen in people between 20 to 40 years. Initially, it was believed to be the disease of the Caucasian races, but then in the last 30 years which I have been practicing, and plus people who have been seeing around the world, we have been seeing MS in not only whites but also in the brown and the black races. It is common. There is some genetic predisposition for this and some environmental factors which have been hypothesized, but nothing has been established. But the basic pathology which is underlying is the autoimmune effect, where the body's defense mechanism is under attack by the antibodies produced by the patient's own body. Now, I would like you guys to understand the different ways in which the disease progresses, or the different types of multiple sclerosis which have been classified. The types of multiple sclerosis have been classified depending on the progression of the disease. Now, as I go on, I will use the diagram and try to explain to you guys so that you understand the basic concept here. Now, we plot a graph here. Okay, this is the time, it's a duration, and this one is the disability. Basically, there are 4 different types. Now, the first one and the commonest one which we've been seeing all over is known as the relapsing-remitting type. Now, what is relapsing-remitting? Now, the patient has an episode. It could be anything depending on the symptoms. It could be an episode where the patient loses vision completely, and over a period of time, which could last from a few weeks to a few months, the patient starts improving because there is some remyelination taking place, but the patient may not come back to complete 100%. But in whatever level he or she comes, they continue to remain that way for some time, maybe a few months again and a few years. After that, they tend to have one more episode, which may be similar to the previous episode, or it may manifest in a different way. For example, the first episode would have been basically the visual problem. The second episode, the patient could have weakness in his leg. Even here, the patient starts improving over a period of few weeks and months, comes back, goes again, months pass, weeks pass, the patient has one more relapse. So here, this is the relapse where the patient shows the symptoms, and this is the remission phase where the patient is free of symptoms. This goes on for years together. Relapse, come back, start leading the life, relapse, come back, relapse, come back. Now these relapses could be, like I mentioned earlier, it could be the same symptoms, or every time the patient could have different kind of symptoms. So this is known as the relapsing-remitting type of multiple sclerosis, RRMS. Some patients may not be so lucky. Initially, the patient may have the same manifestation. Patient may have one relapse, go back, then have one more relapse, go back, remit completely, and then have slowly progressing upwards towards more and more disability. So I hope you understand here. In the first one, the patient was remitting, coming back to almost normal and going on. But in the second type, initially it is remitting, the patient is improving, but then after a few episodes, the disease continues to deteriorate. This is known as secondary progressive. Initial relapsing and remitting, subsequently progressing continuously, the disease takes a downhill course. The third one is a combination of the first two. The patient is having a relapse but does not come back here, stays here, then has another relapse this way, has another relapse this way, has another relapse. So if you see, every remission, the patient is deteriorating. Whereas here, the patient was coming back to almost normalcy. Here, there is an ongoing disease which is on a downhill course. Superimposed by that, the patient has relapses. This is known as progressive relapsing MS, or the PRMS. And the fourth one, which is the worst among all of these, is the disease starts and it goes on. It's a complete downhill course without any pause, without any relief to the patient at any point of time. This is known as the primary progressive. So I hope I have tried to make things clear and easy to understand. Relapsing-remitting, where there's an acute exacerbation, patient comes back to almost normal, acute exacerbation comes back to normal. Secondary progressive, initially it remits, it comes back, but after some time, after a few months, after a few years, after a few relapses, it continuously goes a downhill course. The third one, progressive relapsing, where there is a downhill course. On top of that, there are exacerbations, and in the worst condition, where from day one, it is just going downhill. Now, how long does it take for the patient to get completely bedridden? It is anybody's guess. It follows a different course in different kinds of patients. Okay, finally now coming to the treatment options. Now, multiple sclerosis has been a disease where it has been bothering clinicians for decades now. From the time the disease was established, people have been working on different types of treatment options to see that the patient gets relief. There are a lot of drugs available in the market, and I'll briefly try to cover a few and then go on to say as to what I have to offer here, or what Plexus has to offer here at this point. One of the commonest use drugs which has been used from time immemorial, and even now a lot of people still are using it, are the corticosteroids. And then came the disease modifying drugs, the immunosuppressants. It started off with the interferons, the alpha interferon, the beta. They did different subtypes of these. Then came glatiramer and tecfidra. There have been drugs which have been coming in the market. Right now there are more than about 14 to 15 types of drugs available. But the problem with all these medications are that they suppress the immune responses, because of which the patient is exposed to a host of infections. The immunity goes down. Some of the drugs block the white cells. Some of the cells completely deactivate the immune response. So here what you're doing is trying to suppress the autoimmune condition. You are destroying the entire defense mechanism. So you're making the patient more susceptible to hosts of infection, and which defeats the purpose. But well, that is what is available, where we find some of the patients have responses, some of the patients' disease is controlled, some of the relapses improve, so it has been used. Besides that, people have also used plasmapheresis for a long time, and we have mixed results with that. For the last 9 years at Plexus, we have been using what I call it as a regenerative rehabilitation. Now, if you go back to the symptomatology, the way the patient manifests, I was talking to you that the patient may have a huge array of symptoms depending on the region of his CNS affected. It could be the cognitive symptoms, where the patient's cognition is gone, patient's thinking is gone, patient is not oriented properly, patient's memory is affected, and so on and so forth. To patient's emotional life could be disturbed. Patient might have bouts of depression, bouts of anxiety, panic episodes. Patient may have seizures. Patient may have motor symptoms. There could be paralysis of either 1, 2, 3, or all 4 limbs. Patient may have sensory symptoms. Patient, they would feel numb in certain parts, have hyperesthesia or tingling numbness, or and something like ant crawling or electric shock going through the spine. Patient may have problem in balance, feeling dizzy. So there are a lot of symptoms with which the patient presents. So at Plexus, what we do is we first have a complete analysis of the patient's symptomatology, motor, sensory, cognitive, emotional, whatever. Based on that, we make a comprehensive program where the most important component of this is stem cell therapy. If you go back to my previous presentations where I have been talking to you as to how stem cells work, what is the procedure, how do we take the cells, it's all been told in my previous presentations. But again, coming back to just reminding you on the few points, we take a small sample of the bone marrow. From the bone marrow, we take out the mother cells and try to make the neurons, or the neural cells, or the pure mesenchymal cells, depending on what we need, and then these cells are injected back. Now, the stem cells go inside the patient's central nervous system and start functioning there. Along with the stem cells, we also do the rehabilitation depending on the symptoms the patient has, either cognitive rehabilitation therapy, physical therapy, occupational therapy, psychotherapies, or whatever, choosing from the complete spectrum of rehabilitation programs we have. And as the stem cells go inside, start multiplying, start repairing the myelin damage, which I was showing you in the initial part of my discussion, where the rubber casing on the wire was nibbled off, there were defects in that. Now the stem cells go and start repairing that. At this point of time, while I'm talking to you, there's so many of my patients come to my mind who had come to us after we started stem cells in the last 8-9 years. One of the most famous patient who had come to me in around 2013-14 was a 32-year-old lady from the West Indies, from Trinidad and Tobago. Now, this lady had come to us with symptoms. One was visual problem. Second, she was unable to speak properly, and she had weakness in all four limbs. In fact, to such an extent, she could not even sit on a chair without balance. Even her trunk was weak. Now, we did the same thing. We gave the stem cells to this patient and started a rehabilitation. And every day, every week, we were just seeing progress in her improvement. Her vision started improving, her speech started becoming better, her strength started coming back. And when she left us after 3 months, she was more than 60 to 70% better. She was able to walk with a walker. Her hand grip was there. She was holding the walker and taking a few steps. Her speech, we could comprehend. She could count fingers. After 3 months, she went back and we had a continuous follow-up with her. About 8 months later, this patient's vision had improved almost about 70-75%. And the improvement continued subsequently, and she was not on any medication except supplements. There are thousands of such cases, such patients who have come to us, young university students, young housewives. We had one more very young man, very handsome guy from Tamil Nadu. He was in his late 20s, and he improved within weeks. And not only that, most of these patients, when we compare the MRI, MRI before starting the treatment and MRI after we finish the treatment, the patients, the problem in India we have is the poor follow-up. Whichever patients who have been with us, following us, coming regularly once in 2 months, 3 months, we have been able to demonstrate on the MRI that these lesions, those white plaques which we call them, have reduced in number. In fact, there are some patients where there was the lesions were no more active, and a lot of patients where the lesion count itself had improved. So at Plexus, we make a comprehensive program which is tailor-made to suit the patient's need, and yes, try to avoid as much as possible any medication except some supplements, and teach the patient a healthy life, and the patients continue to improve. So that was the presentation on multiple sclerosis on this World Multiple Sclerosis Day. Now, if you notice, I'm sporting an orange ribbon. Well, orange is the color for multiple sclerosis, and like I mentioned, the theme now is connection. So guys, let us establish connection. Now, whoever is present today, please spread the message. Connect with patients who are suffering from MS. Connect with people whom you know have relatives suffering from MS. Let us try to help these people. Let us try to help this community live a better life, a healthier life. If you have any questions, if you have any comments, please post them. Write to me, mail me, call me, WhatsApp me. I'll be glad to answer all your questions. So that was the session. Please follow us on our social media, and we will be updating you. And I'm going to come back to you very soon with yet very, very interesting and a very common neurological illness which affects millions of people around the world. Bye-bye. Have a safe evening. Thank you so much for watching this presentation and being here.